All right, I think we're going to get started. Thank you so much for being with us here today for our monthly webinar series. My name is Megan Lyle. I use she, her pronouns, and I'm the health educator for the Alabama Campaign for Adolescent Sexual Health. And just before we get started, I wanted to share a little bit about what we're doing this year. So we just started implementing two youth workshops. One is called Include and the other is called Lift. And we're working with partners to just host the workshop and help us recruit for these two programs. So Include is a 3-hour workshop that centers LGBTQ and allied youth. And it covers topics like STI prevention, pregnancy prevention methods, consent communication, navigating the healthcare system, and advocating with a provider. It's a great program. And then the other is called Lift, and it's a 6-hour program for teens and their supportive adults. And that is more about like sort of navigating tough conversations. There's a sexual health component that includes a condom demonstration. And is more about like family bonding. So if you're interested in or like connected to young people, if you are a young person on the call and are interested in these programs, I'm going to drop my email in the chat. And yeah, we're looking for partners to like have like a facility to host the workshop in and then help us with the recruitment process. But today is more about our webinar speaker. So we're welcoming Tazmine Weisgerber, who is the Training and Technical Assistant Manager at Answer, which is a national nonprofit based at Rutgers University, which provides and promotes comprehensive sex education around the country. So this talk today is about visibilizing and sort of including intersex identities in our sexual health curricula. And I'm really excited for this talk. So yeah, I am going to pass it over to you, Taz. Thank you so much for being with us, and thank you all for joining.
Thank you so much, Megan. And I just sent you a link to my presentation because I just got a notice that my internet is unstable. So really hoping I don't get kicked off, but if I need to, I can hop on my phone if you'd be able to share the slides for me, just in case. So hi, everybody. Thanks so much for joining us today. I'm really excited to see you all here, and I'm really excited to talk about this topic. So I'm going to go ahead and share my screen so we can get started. Still in my, there we go. Okay, y'all can see my screen? Awesome. All right, so this is the InVisibility of Intersex Folks in Sex Ed. My name's Taz Weisgerber. I accept she, her pronouns, and I'm going to tell you a little bit more about Answer in just a moment. But first, we do like to cover some group agreements, and I did want to do some content warnings. We are probably going to be covering suicide and as well as non-consensual surgeries. There may be some other topics that come up as well. So as far as group agreements, we like doing them as images, as you can see, whether that's with young people or adults. So to save time, I'm going to go ahead and share some of these for you, although typically we would ask folks to share out what they feel these images represent as far as group agreements. But the couple I really want to focus on today are the person at the bottom in the yellow sweater that is hugging themselves, and that is meant to represent self-care. So I really want to make sure that you all are caring for yourselves as we go through this hour workshop. If you need to step away for a moment because something is just a little bit too much for you at any point, please feel free to go ahead and do so. Another one I wanted to bring to everyone's attention is the I in the corner. So that is meant to represent I statements, making sure that we are not making blanket statements, owning when we're talking about our own beliefs or values, and understanding that we all have different beliefs and values. And the rainbow in the eye stands for inclusion, right? So in the case of the rainbow, that's particularly being inclusive of the queer or LGBTQ plus community, but we want to make sure that we are being inclusive of all groups and identities. And please, I would love for us to hopefully have some fun along the way. Please ask questions. I do have a section at the end specifically for questions, but please ask whatever questions along the way as they come up for you. All right, so a little bit about me. I started off my career as a sex educator at Planned Parenthood, and now I am a sex education trainer, mostly providing professional development to sex educators, but I also get to do some PD for pretty much anyone who has conversations with young people about sex and sexual health. I have a bachelor's in health education with teacher certification in New Jersey. And I'm currently receiving my master's in feminist practices for social change at Rutgers University. And this is really how I got so invested in this topic, because I did a lot of research on DSD, which we'll talk more about what all these acronyms mean, also known as intersex, and realized that there was so much about this population that even myself in the field of sex ed, I just wasn't aware of. And so I wanted to learn more and see what better sex ed, what better advocacy we could be doing for this population. So Answer, as was mentioned, is a center at Rutgers University, and we focus on comprehensive sex ed. As I mentioned, some of that is through providing professional development, which you'll see here. We do in-person and virtual training, as well as online courses that folks can take that are asynchronous, including our certificate in adolescent sex education basics. And then we also have a section that is dedicated for direct education of young people, called Sex Etc. It was a magazine that was published for over 30 years. Now all of our content is available on sexetc.org, and it's content that is geared for teens, that is developed by teens. So feel free to use that as a resource. And the agenda for today, we're going to start off with a very brief icebreaker. I'm going to get into some history and background of the intersex population, go through some tips on how we can be better at being inclusive of this population and how it will benefit everyone. We're going to go through some resources and wrap up. And then, as I mentioned, we'll have a question section, but please feel free to ask those questions at any point in time. Oh, and thanks for popping in our website on there. All right, so first I want to start with, what do you all already know about this population? What do you know about the history, types of differences in sex development? So feel free to go ahead and pop that in the chat, or if you'd like to, you can come off of mute and share. And I know y'all know something. Give folks a minute to type if that's what you're doing. Aha, about 2% of the population is intersex. Thank you. What else y'all got? There's a wide variety of intersex genitalia and what it looks like. Yep, not every intersex person knows they are intersex. Absolutely. You don't know much, that's why I'm here. Thanks for your honesty. There are dozens of sex chromosome variations. Yep, there are many different variations of all different types of intersex variations that we'll talk a little bit more about. Let's see if maybe one more. Aha. Oh, a couple more. I've worked with a few clients in my field as the sexual assault advocate and speak in length of the history and gender expression and struggles. Yep, absolutely. Intersex people are often pushed into operations to assign gender. Absolutely. Intersex people often get wrongly identified as transgender. Yes. I saw an after-school movie when I was a kid that portrayed a family experiencing this. Hopefully it was a good portrayal, although it's likely that it might not have been, because that's usually the case, unfortunately. and assignment surgeries and the role of the, oh, yes, we will be talking about the phallometer or philometer, however folks want to pronounce that, in a couple slides. Awesome. Thank you so much for all that. And we will be covering much of that very soon. So what is intersex? So when we look at the LGBTQ or LGBTQIA plus, or many of the other variations in that acronym, the I stands for intersex, right? So a lot of advocacy groups or organizations that focus on the LGBTQ community often include intersex as part of their populations that they serve. We'll talk about whether we feel they're doing a great job of that or not. Interact defines intersex as an umbrella term for differences in sex traits or reproductive anatomy. And Interact is an organization geared specifically for intersex youth. And the Intersex Society of North America, which was the first organization or society in the United States, no longer exists, and Interact has kind of taken over their website. But they define it as a variety of conditions which a person is born with, a reproductive or sexual anatomy that doesn't seem to fit the typical definitions of female or male. Some general information. So just like everything in life, intersex is a spectrum, right? So there are many different points, many different variations, and many different lived experiences of people who are intersex. There are roughly 30 different variations, and I say that because there is not agreement on which variations folks consider intersex. Some folks consider, for example, PCOS as an intersex variation, and other folks don't. So that's why it's hard to put an exact number on the amount of different types of intersex variations. 1.7 to 4% of births are guesstimated to be intersex. We don't really have an exact number because this is not something that is reported. And as was brought up, some folks don't ever find out that they are intersex. But the research shows somewhere usually between these percentages. So it's similar to the number of people born with red hair in the United States, just to give you a visual of what that represents. And so, as we were mentioned, some folks, it's evident at birth because they can visibly see from the anatomy. Some folks don't find out until puberty, when the changes that are happening to their body are not the changes that they expected to happen. Some people don't find out until they may be experiencing issues with fertility. And so maybe they go to a fertility specialist, and then they find out through extra testing that way. And some folks never find out because they never go through the tests or never had any of those signs to let them know. Yeah, a lot of folks aren't aware about the PCOS thing. Love the comparison to redheads. Yeah, absolutely. To show that it's a lot more folks than people really realize. And in almost all cases, surgery is completely unnecessary. What researchers show is that the only time surgery is really medically necessary is if there is a blockage of the urethra. Other than that, there typically is not any other reason for folks to do surgery, and it's normally simply just elective for aesthetic purposes or to make someone's anatomy align with what it is supposed to look like, depending on whatever gender or sex that the parents or guardians decide that that child is going to grow up as, which, as you can imagine, isn't always correct, right? Because taking the idea of folks are transgender, right, off the table, just the fact of guessing which sex is going to be the dominant sex, there's just way too many variables in there for folks to perform surgery, sometimes multiple surgeries. Because when you think about it, young people's bodies have a lot of growing to do from the time they're infants or toddlers into their grown-up bodies. And so some people have to go through multiple surgeries. In one case, I saw up to 22 surgeries in one person. So completely unnecessary unless there is a medical need for that surgery to happen. And I also like to throw in here, we should not be using the term hermaphrodite, although is a term that some folks may still use. This is deemed as a slur nowadays. It's also not correct. So the term hermaphrodite is used as a term for folks who have both male and female external genitalia. And I use the term male and female as what we typically, deem as male or female. So that isn't always the case, right? We talked about that there are a variation of different kinds. This is a very rare form. Most folks do not have both male and female external genitalia. So speaking of terminology, there are multiple terms that folks may use to talk about this population. So the first one that was most prevalent, especially in the medical community, and they still use this, is disorders of sex development. When I say DSD, I am not using it to mean disorders of sex development. The reasons for that are it is very medical and it pathologizes, right? So it makes it seem like there's an issue with being intersex. And that's not the case, right? We talked about that it is a spectrum, just like everything else, right? We all have a spectrum of hair colors and eye colors and heights and things like that. So differences in sex development or the intersex population is simply just another point along the spectrum. So we should not be calling them disorders. So I'm going to go ahead and give that a thumbs down. So we should not be using disorders of sex development. The next term is intersex, which is in the title of the webinar and is the one that is most commonly known. This is better than disorders of sex development, but I do like to acknowledge that there isn't really agreement on this term. So some folks who identify with DSD or differences in sex development, which we'll talk about, may not like the term intersex and may not choose to self-identify that way. So we sometimes want to be careful when we use that term, and definitely don't use that term for someone who has identified that they do not identify with that term. But most of the time, organizations and advocacy groups use the term intersex. So we're going to give that one a caution sign because we want to be careful when we use that term. Next is differences in sex development. So it is more true, right? It is simply a difference in the development of someone's sex, and it is not harmful, right? Because differences is accurate. So we're going to give that one a smiley face because that one is definitely okay to use. So like I said, when I use DSD, I'm talking about differences in sex development. And then another one that I have seen sometimes used is variations in sex characteristics. So very similar to differences in sex development. So this one, we're also going to give a smiley face. So I will try to use a variety of these last three terms. Will not be using disorders of sex development. Any questions about any of these terms? Have y'all heard any of these other ones besides intersex? And there is definitely a push for the medical community to start using differences in sex development or variations as opposed to disorders, but it doesn't always happen. Okay, I see. I've only ever heard intersex. Yep, that's what I hear from most folks. So now you've got some new terminology, some new vocab you can use. Awesome. So a little bit more background. So intersex bodies have always existed. This is not anything that is new. What are some reasons why you think that maybe they haven't always been as talked about, or why are we talking more and learning more about differences in sex development now compared to the entire history of our bodies? And while y'all are putting that in, I see somebody has ICD-10 changed their terminology. That is a wonderful question. I do not know. I can go ahead and take a look into that and see if I can find the answer for you. So I see folks are sharing, people are getting more comfortable talking about genitals. Yep. More research, easier exchange of information. Absolutely. The internet has definitely helped with that. Gender norms. Yep. Lots of different norms there. Easier to identify now and understand the genetic basis. Yeah, we definitely have more science and research to back up these things. Absolutely. Wonderful. So in the, as we mentioned, they have always existed. However, in the 1950s, surgery to change the anatomy of people who are intersex became available. It was not, the surgery was not developed specifically for intersex people or infants, usually. However, it was used for folks who are trans and wanted uh, surgery to get their genitals to align with the gender that they identify with. However, once that surgery became available, they did start using it for young people who were born with intersex bodies. By the 1960s, most hospitals had a DSD team, which was comprised of doctors, psychologists, endocrinologists, and many other folks who, when would come together and provide input and assist the parents and guardians on providing suggestions and things about how they should handle when an infant is born intersex. And I see some folks adding community connection is easier. Is the data used in the one webinar 100% US data? Everything that I've used so far, yes, is US specific. Research shows that they guess that approximately 5 infant surgeries per day happen in the United States. Again, this is not something that needs to be reported, so it is really difficult to find that exact number. But based on their research, this is what they found, about 5 per day, which is a very high number when you think about it. And so considering most of those are completely unnecessary, that's a lot of young people every year that are having surgeries that are completely medically unnecessary, and they may not ever even find out about them. It is becoming more common now for doctors to encourage parents to let their children know that they were born intersex and that they had surgery. But for many, many, many years, it was encouraged to never inform the young person because they thought that it would be too difficult for them to handle. Yeah, that is a lot. The guidelines and practices for medical professionals to navigate youth-born intersex was and is still very sexist and heterosexist. So, for example, they were encouraging young people who were born with vaginal canals that were insufficient, in their opinion, for engaging in penile vaginal sex. They were encouraging them to lengthen the or deepen or widen the vaginal canal so that those people, when they marry, their husbands would be able to have sex with them, was the reasoning that they gave for why a young person would need this surgery. So really not great guidelines. And unfortunately, most of those are still in place today in the US. There are other countries that have completely banned non-consensual and medically unnecessary surgeries on intersex youth. The US has not gotten there yet, which is really unfortunate. Yeah, it is really gross to, to think about. As I mentioned earlier, the Intersex Society of North America, or the ISNA, was created in 1993, which was not that long ago, and it was the first organization of its kind. It originally started out as a support group. There was, oh my goodness, now I am blanking on her name, Cheryl. I want to say Chase, but I feel like I am missing that. If somebody can remember the name, please feel free to help me. She developed it in 1993 because she had had surgeries as a young person, multiple, and she felt that she was really harmed by those surgeries, and she knew that there were others that existed. So she developed this as originally a support group so that folks could come together and talk about their experiences and share and know that they aren't the only ones who are going through this. But eventually it changed from a support group into an advocacy group, and they did a lot of promotion of trying to change the guidelines and try to get rid of the non-consensual surgery on infants. So in 1996, on October 26th, there was a conference the American Academy of Pediatrics was hosting, where a few folks from the ISNA were scheduled to present, and they were going to talk about what updates they think should happen for guidelines and to talk about how the community needed to stop the non-consensual surgeries. They ended up being kicked out of the conference. They were not allowed to present. And so that ended up turning into the first large protest for the intersex population. And now that is known as International Intersex Awareness Day. So since then, there has been a lot more advocacy and some changes have been made. But again, the United States still has a long way to go, unfortunately. They also were more likely to create female genitalia regardless of chromosomes, etc., because they weren't able to create functional penises. Yes, they were famously said it's easier to make a hole than a pole. Yeah, which is really not great. So yeah, I think the numbers are somewhere around like 90-ish%. They were assigning female simply because it was easier. And yeah, that brings us into all the issues with Dr. Money, and I don't like giving him Cheryl Chase. I was right. Thank you. Thank you, Julie. Yeah, Dr. Money did some really terrible things, and that's where a lot of the guidelines came from. So someone earlier mentioned the phallometer or phallometer. This is a bit of satire, although is based on actual medical standards. So what this shows is that when an infant was born, if the genitalia, the clitoris or the penis or that area of tissue was under 3/8 of an inch, that was deemed appropriate for a female body, and so that was okay. If it was over an inch, then that's a boy and we're good to go. However, if it was somewhere in that in between, which you can see is a pretty large area, then that was deemed unacceptable, and surgery was then recommended to either lengthen or shorten that area to make it better align with whatever sex or gender they were assigning to that young person. I did try to look to see if these were still the guidelines, and I, for the life of me, could not find anything that talked about this, but it is very possible that this is still what they are using as their guidelines. So how did I get into this? I talked to y'all a little bit about this, that I learned some stuff in my master's course, and then I started doing a whole bunch more research and chose to write a few of my course papers on the intersex population and how sex ed could be doing a little bit better. So I'm going to show you some data from the mental health and well-being of LGBTQ youth who are intersex. And this is from the Trevor Project in 2021. And they pulled this data from their annual mental health of the LGBTQ plus youth. And what is interesting is when they do that annual survey and they release that information, they ask about whether folks identify as intersex. However, they do not include any information about data of intersex folks in their annual data. So this study that they gave as kind of a after the fact where they pulled this data is not something that they normally do, even though they have the information where they could include it every single year. But some of that information shows that 18% of intersex youth reported being subjected to conversion therapy, with 12% aimed at changing their gender identity. 2 out of 3 intersex youth reported that someone tried to convince them to change their sexual orientation or gender identity. So we can see that there are lots of intersections here for folks who are intersex, because there is not only the gender identity of the person, whether their parents gave them the appropriate gender or not, but there's also their sexual orientation. There's also their anatomy. There's lots of different ways where intersex folks can have issues that pop up. And intersex youth reported twice the rate of having had a mental or physical healthcare provider attempt to convince them to change their sexual orientation or gender identity, or in some folks, both, compared to LGBTQ youth who are not intersex. So that's not even, the full population. That is specifically compared to LGBTQ youth who are not intersex. Some more data from the same study: intersex youth with at least one parent who was accepting of their sexual orientation had 55% lower odds of attempting suicide in the past year, and that was 46% for their gender identity. Intersex youth who have supportive friends reported lower rates of attempting suicide in the past year. And transgender and non-binary intersex youth whose pronouns were respected by all the people they live with had 64% lower odds of reporting a suicide attempt. So very much like the rest of the LGBTQ community, when there is acceptance, support, when young people are able to live the lives as they are, then they have much better mental health outcomes. And we know that. Will the slides be available? You will receive a recording of the presentation, if that's okay. If not, you can shoot me an email. I can give you a PDF of the slides. So thinking about all that information and what you all already know about sex ed, do you all feel that sex ed is inclusive of the intersex population? What do y'all think? Yeah, I see some no's. Anybody have anything other than no?
I feel like a lot of times, like, biology and gender get conflated in sex ed.
Yeah.
And there's a lot more attention now on gender identity. But there's still, in a lot of the curricula that I've seen at least, there's still a lot of like binary when it comes to biological sex.
Absolutely. That's exactly what I would say, that we've come a long way in a lot of areas with the LGBTQ plus community, and I feel like the intersex population is one of the last that really just hasn't gotten the attention that it deserves. I don't want to mispronounce your name, but yes, you can go ahead and share.
Thank you. My name is Colleen. I find that more and more differences in sex development is used in teaching of gender as an example of sex not being binary, unlike what we believe it is, to justify that therefore it makes a lot of sense that gender also isn't. Because there's often this conflict of you have to be man or woman, and that's what, there are only two sexes, therefore there are only two genders, and then like, actually no, there aren't just two sexes. So I find that's coming more and more as an argument to support the gender discussion.
Yeah, you are absolutely correct. And that is something that I wish we did more of to not only help the trans community, but also help the intersex, the DSD population, right? So we're going to talk in a minute about how being inclusive and advocating for folks with DSD can benefit many more people than simply the 1 to 4% of us that are intersex. So little bit more. In most lessons and curricula, they are not included at all. In some cases, there are sometimes unintentional inclusion. So ways that we are using strategies like not gendering the genitalia, or talking about things more on a spectrum, that can sometimes unintentionally be more inclusive of intersex folks. But usually there is not any intentional inclusion of the DSD population. So kind of going off of what I just was talking about, has anyone heard of the curb cut effect before? And it's very unlikely because most people haven't. This is something I learned while getting my degree, but I'll give it a second just to see if anybody might know. No, okay. So the curb cut effect gets its name from a curb cut, like you can see in the image. So curb cuts were originally developed and put into the curb as a way to provide an accommodation for wheelchair users. That way they could get on and off of the curb more easily. However, are people who use wheelchairs the only people who benefit from having a cut in the curb to get on and off of the curb? No, right? There are many other folks who also benefit from this, such as people who are using strollers, children, senior citizens, people with visual impairments. So even though this accommodation was specifically for a small group of people, right, wheelchair users, it actually ended up benefiting a much larger group of people. You could say almost everybody. So that is the theory of the curb cut effect, that same way that a accommodation or an inclusion meant for a small group of people actually benefits a much larger group of people doesn't just happen with a curb cut. That really happens with pretty much everything. You may have learned that, or if you haven't, then some other data. When we are inclusive and create supportive environments for any marginalized group, let's say the LGBTQ population, it doesn't just help that small population, it benefits everyone. So if we were being more inclusive of the intersex population, it isn't going to just help those folks. It's going to help a much larger group of people. And I would argue that it would actually benefit everyone. And we can talk a little bit more about that in a minute. But that is the theory of the curb cut effect. So I think that this is an argument that comes up a lot for a lot of marginalized populations that within the field of social justice, we can get some pushback on sometimes. And so something that you can share is, sure, this might be a small group of people, but when we use these strategies, we're actually helping everyone, not just this small group. So it's really awesome that these strategies and techniques can help a much larger group of people. So I'm going to go ahead and share with you all some ways that, and these are just examples, this is not an all-inclusive list, but some ways that I feel that we could very easily be more inclusive of the intersex population, from kindergarten, elementary school, all the way up through all of the grades, all ages, as well as some other populations like parents and caregivers and medical providers. So if we had more time, I would have tried to pull these from you, but for the sake of time, I'm going to go ahead and share. So for elementary age, one thing that folks could do is prevent gender policing. that is going to be helpful, especially for intersex folks who were not forced into one sex or gender or the other. They are much more likely to identify as non-binary or gender diverse. And so preventing gender policing can help this community, as well as lots of folks like the trans community, or just people who may not fit in with what is deemed socially acceptable gender norms in our culture. Talking about the differences in puberty. So not only going, what some folks have been doing now is, instead of saying, here's the changes that happen to boys' bodies, and here's the changes that happen to girls' bodies, now we're talking about them more as, here are all of the changes that may happen to people's bodies. That way, folks learn about all of them, see that most of the changes that happen are the same for everyone. And that way, if folks who are intersex but don't know it at that point start experiencing those changes, it may not be as big of a shock to them. I see a question: with new bathroom legislation passing in conservative states, how might this affect Yes, so this is exactly one of those areas where if we were talking more about intersex people instead of completely leaving them out of the conversation, not only for bathroom legislation, but also for sports as well. When we are forcing these mandates that require these chromosome tests or hormone tests and things like that, it's not just harming the youth that are transgender, it's also going to harm and out intersex youth. And this is something that has already happened in the Olympics. Decades ago, there were Olympians that were outed because they implemented this, and it's always only in female sports, women's sports, that this happens, right? Because they don't have enough issues that we have to deal with already. Yeah, all of these things are also harmful for intersex folks. So not only can including this help benefit the arguments against anti-trans policies, but can also be helpful for intersex folks. So it can serve multiple purposes. We can also talk about the variation in anatomy. So when we're learning about anatomy, most folks have body parts that look like this and these body parts. However, there are also these, many other variations, and let folks know at that age that they exist, that our bodies are a spectrum, just like everything else, right? Like I talked about, we have different hair colors and shapes and sizes, and that anatomy should not be taught any different of a way. They shouldn't be taught that everyone looks this way. And not only is that going to help intersex folks, that's also going to help people who may have feel shame about the way that their anatomy looks. And that happens to people who are not intersex as well, right? There are lots of folks, especially for once young people start, or adults start, looking at pornography and start comparing what their bodies look like to what they see on screen. And then they feel shame that their vulva or penis or breasts don't look like what they see. When we talk about this variation, it can be helpful for those folks to not feel as much shame as well. So you can see how, including these things is going to be really helpful for everyone. We can also start talking about the LGBTQIA plus community and all of those different identities. Yeah, absolutely. There is a lot of shame around all these things. So yeah, exactly. It would help everyone. For 6 through 12 students, and even through college, using gender neutral terminology when we are talking about things, not using gender at all when we're talking about body parts. So when you are teaching about how to use a condom, don't you say, a man's penis, right? It's just a penis. Oh, thank you, Megan. Those are some of the athletes who have been vocal about it. Awesome. Doing some intentional education specifically on the DSD population is something that can definitely happen in 6th through 12th grade in college. Talking about porn literacy, and not only talking about that Not everybody's bodies are going to look like what they see in pornography, but also talking about even the fetishization, it's a tough word to say, of people who are DSD as well. And start talking about reproductive justice, right? About the non-consensual surgeries that young people are experiencing and how it's completely unnecessary. Not only is this going to benefit, again, the intersex population, but these young people are going to end up growing up and becoming parents who may end up having an intersex child. People who are going to grow up and enter the medical community, that are going to become advocates, that are going to become health and sex ed teachers. So giving them this knowledge ahead of time will help to already have all of this normalized, so that we hopefully don't still have all of this shame and stigma. And so when people become parents and they're told they have a child born with DSD, they are not going to be as willing to listen to a doctor that says, hey, we need to do surgery on this child. And we can hopefully help to prevent more non-consensual surgeries. For medical providers, again, surgery only when necessary. We should be providing better parent education and trying to reduce the stigma, fear, and shame of bodies and anatomy that is different, and help them to realize they need to encourage change. When we need change within the medical community, unfortunately, they don't really like listening to folks outside of the medical community. So that change really needs to come from within, and we need to get more medical providers on board advocating to change these policies and ban non-consensual surgery. For parents and caregivers, they need better education before they have children, when they have children, letting them know about the harms of unnecessary surgery. Teach their children to respect people of all different kinds, and giving tips on how to parent a child born with DSD, talking about that you can have them labeled X on their birth certificate in some states, that you can raise them non-binary, although that may be something that folks may do anyway. It can definitely be especially beneficial for youth born with DSD. And then for advocacy groups, groups specifically geared towards the LGBTQIA plus community need to do a better job of being inclusive of the intersex population. They need to make sure that they are including this when we talk about issues that affect trans people, like bathrooms and sports, and just more advocacy and education in general. We can't keep forgetting about them. Make sure that they include sex development and characteristics. So you may have heard the acronym SOGIE, SOGIE, for sexual orientation, gender identity, and expression. That's often used as another way of talking about, the queer community and the difference and the variations. However, using that acronym completely leaves out the intersex population, because those don't sex characteristics or differences in sex development are not part of that acronym. Like I mentioned, better anti-trans policies, arguments, and talking about how this benefits the entire queer community and the entire community as a whole. So inclusivity is possible. This link will bring you to a really awesome Google Doc that has a whole bunch of links on a bunch of different visuals and things of different anatomy, not just for intersex variations, but for people with different sizes, shapes, colors. Really, really awesome resource. Some of them are free, some of them are posters that you can purchase. Really, really awesome. And then on the left there is an example of a resource that I'm hoping to get onto that link that is from a book that is actually being published in Canada. It's a biology textbook that shows a bunch of variations in intersex anatomy. And what's really awesome is they color code everything. So in each variation, all of the organs are the same colors. That way you can see how the different variations differ and where those body parts end up. It is by and far the absolute best resource that I have seen yet on intersex anatomy. And they do want to make sure that that is widely accessible and available. It is currently only in French. If we have any couple minutes at the end, I can show you all some other variations that are included on there, but they did let me know they are translating it into English to make it more accessible for folks. So really, really awesome resource there. Some other resources. The Intersex Justice Project is an advocacy group geared specifically for the intersection of young people who are intersex, who are also youth of color. Interact has lesson plans for teaching young people about DSD. Interface Project has a whole bunch of stories of actual people who identify as intersex, and they share their stories of their lives. The Intersex Campaign for Equality is uses a bunch of different kinds of art to provide education and advocacy. The DSD Families is actually based in the UK, but they have a lot of really awesome resources for families of with youth who are DSD, who have DSD. And they have a lot of links for additional resources on there as well. And these are just a few. There are a lot. And time for any additional questions, although folks were asking along the way, so thank you. But yeah, I'd love to open it up if anybody has any additional questions at this point. And I'm going to stop my share so I can see everybody. All right, well, while folks are thinking of questions, actually, maybe I will share the resource that has the other visuals. Oh, I see a question. Is there any data on how intersex folks feel about being included in the LGBTQIA plus umbrella? Good question. So from what I've seen, the majority of people who identify as intersex want to be included in as part of the queer community. But just like I mentioned with the terminology and which variations are included, there is, you know, some disagreement there. So some people do not feel like they should be included. And thank you, Megan. Awesome. Okay, so let me share. Where is that resource? Here we go. So yeah, you can see it's in French, but shows a bunch of different variations. And I think they did a great job. They showed, you know, people with different size bodies. They didn't put any color for skin color. And they told me that they specifically, it took them years to make these because they were not able to, it was really difficult to find the data that showed exactly what all of these body parts look like internally. And they said that they wanted to make sure that they got everything correct and that they weren't just guessing. So it really took them a long time to develop this, and I'm very, very happy that they want to make this a free resource that is widely available for everyone to be able to use. So I think it is really great. Yes, yes, you're welcome. Is genital surgery more beneficial in infancy rather than adulthood? Is it better to allow babies to develop naturally and offer interventions in adolescence or adulthood? Yes, it is much better to allow their bodies to develop naturally because first of all, we don't know what gender they're going to identify with as they grow older. We don't know what kind of sex they're going to want to engage in, or if they're even going to want to, if that's something that may not be important to them at all. So often these surgeries, yeah, they may end up doing a lot more harm. So yes, the recommendation is definitely to wait until the person is old enough to make those decisions on their own. That's not surprising since we hadn't even mapped the entire clitoris until fairly recently. Yeah, yes, very true. Can you help untangle the language around sexual orientation with intersex folks when we talk about attraction to someone of another sex or gender, which are not the same thing? How do intersex folks tend to navigate this? Good question. So, now there are so many different terms and things like pansexual, right? Where folks, the sex or gender of the person isn't even something that is important to them and doesn't matter for the terminology. That is, you know, an example of one way that this is navigated. But again, it's a variation of variety. So some people, much like people who are non-binary, let's say I was a non-binary person, but I was assigned female at birth, and I kind of maybe identify more with a femme identity. I'm attracted to other people with vulvas. I may still decide that I like to use the term lesbian, even though I may not identify as a woman or female. So that's a way that you know, everybody is different. So intersex folks will use a variety of things. I asked this based on your stat that intersex people whose parents approve of their sexual orientation are more mentally healthy, but what does that mean? Whatever sexual orientation they may choose to be. So as I mentioned earlier, youth who identify as intersex compared to youth who are not intersex have higher rates of not only being non-cisgender, but non-heterosexual. So they're more likely to be something other than heterosexual. So no matter what that identity may be outside of heterosexual, that they're, if their parents are approving of that sexual orientation, that their mental health is in a better place. Hope that made sense. When do we talk about surgery versus mutilation? What does the law say about parental consent for surgeries? Do you know of any doctors or surgeons who are activists for the intersex population? Yes, there are some doctors and surgeons. In fact, when that first large protest happened, the folks who were supposed to present at that conference were doctors. And that's why they were specifically the ones who were going to present at that conference, knowing that people who are doctors listen more to other people who are doctors. But unfortunately, the folks who are in charge of these very large, very old organizations, which you can imagine are usually older, white, cisgendered, heterosexual males, still have decided not to make those changes. And yeah, like we said, there is not any law that bans these surgeries. It is completely legal for parents to consent to medically unnecessary surgery. And even folks who feel, you know, that, let's say, trans youth should not be able to make a decision to even get on hormones to affirm their gender. But they're okay with young people who can't even talk yet getting surgery that they may not need and, you know, may be harmful for them in the future.
May I ask a follow-up quickly, Taz?
I will let the question happen, but I just wanted to say thank you to everybody, and for those of you who have to hop off because it's 1 o'clock, I just please fill out our feedback form, which I put in the chat, and I'll follow up with all of the resources that were shared in the presentation. So thank you for being here. But go ahead and ask your question.
Thank you, Megan.
Last one.
You said that it was not banned to perform these surgeries, but is it also explicitly allowed in the law, or is it more like a gray area?
No, it is completely allowed. Yeah. Which is why there's still so many happening every day. Awesome. Well, thank you all so much. I'm so glad that you all were able to make it. I hope that you all took something from this. Yeah, feel free to share the recording once you get it.
Awesome. Thank you so much. Have a great day.
Thank you. And thank you, Megan.
Bye.